So I want to comment on 3 ways that our body can activate a threat response. And we can have this happen when we're not under an obvious threat. So certainly if we've had a history of trauma, these systems could be activated. But for many people I see, and they may have a history of trauma, but for many people I see it's because they have a biotoxin on board. The most common biotoxin I see in what I do is mold toxicity. If we have a biotoxin on board, our body can be in a low-grade threat response, and it doesn't take much, whether it be an environmental trigger, an emotional trigger, a food or supplement or medication, that could activate these systems. Some people, all 3 are getting activated, and some people just 1 or 2. But the first would be limbic system dysfunction. That can look like hypervigilance, not feeling safe, but not knowing why, and then thoughts and actions to try to feel safe. So that could be micromanaging someone's environment or what they put in their body. It could be excessive searching online, recognizing something's not right, but not knowing what it is. The other can be autonomic nervous system dysfunction. The autonomic nervous system is what puts us into fight or flight or into rest and digest. So if we have a threat on board, we could be having autonomic nervous system dysfunction that looks like fight or flight or even a shutdown. Thirdly, we can have a hyperactive immune system. Now, the first responders to this type of immune response are called mast cells. And mast cells are throughout the body, but they're especially concentrated in the skin, gastrointestinal tract, bladder, and respiratory tract. So if someone's mast cells are reactive and spilling inflammatory mediators, including histamine, that could cause itching, gastrointestinal symptoms. Mast cells aren't in the brain, but they do communicate with inflammatory cells in the brain. So if someone has a biotoxin illness, they can have quite a range of brain-related symptoms and physical symptoms. And many of these individuals will be going from specialist to specialist, trying to find their answers. And because of the way medicine is compartmentalized, unless someone's thinking about complex chronic illness and understanding these 3 threat responses, it can be difficult for conventional doctors to recognize these patterns.